Now. Welcome, everybody. It's nice to see you all joining. My name is Kim Hansen. I'm with Health Partners, and we'll get started in just 1 minute. All right. Good afternoon, everybody. As mentioned, my name is Kimberly Hansen. I am the Chief Executive Officer of Health Partners, and I want to thank you for making some time to be with us today as we discuss how engaging the perspectives of people with lived and living experience can support all businesses really in doing what we do even better. Next slide, please. I want to begin first by acknowledging that I am joining this webinar today from the unceded traditional territories of the Algonquin and Anishinaabe nations, and I'm grateful to be doing so. Today, we'd like to start by briefly introducing you to Health Partners in case you're not familiar with our organization. And then I'll give you a quick overview of our new Health Advisory Network before we dive into a moderated discussion with our expert panelists around really what does the Health Advisory Network mean, or what can it mean for your business? And we'll be welcoming questions via the Q&A at any time. So feel free to pop any in there whenever they spring to mind. Next slide, please. Health Partners is a collective of 20 of Canada's largest and best known health charities, from large organizations like Canadian Cancer Society to rarer diseases like Huntington and ALS. We are honored to support the health charities, who in turn support really 9 in 10 Canadians that will one day in their life be diagnosed with one of the conditions that our member charities support. We, in raising money for them, which is our role, we provide a platform for those affected by serious or chronic illness to share their experiences, share their journeys, and help us all better understand how the health charities that they've relied upon have helped play a part in their journey. Next slide, please. That got us thinking, we already engage people with lived experience to tell their stories and share their wisdom. What if we did it on an even larger scale? What if we created a unified voice of people with all sorts of experiences, of all sorts of conditions, serious and chronic illnesses of all types, and if we were a voice for that home? Next slide, please. That home, that idea, became our Health Advisory Network, which is an online community of people with lived and living experience of any health condition. And so it can be experience that an individual has personally, or it can be the experience that we have as caregivers or care providers when a loved one gets sick. And really any condition at all is relevant. So any person in Canada can join, and we really encourage that as many people join as possible so that we can have as rich and fulsome perspective on the kinds of issues that we're going to be asking about. So of the network, we will be asking questions via surveys or focus groups to better understand what their health experiences have been and what their needs have been and how well they've been met, or how they could perhaps better be met by any part of our health ecosystem. You'll see in a few moments, we've got our first few surveys lined up, and I'll be happy to share the topics that we're planning to dig into and learn from those in the network about. We recognize that the experience that people who have lived with these conditions, either personally or as a caregiver, has great value. And so we will be paying for people's time participating in our surveys or focus groups. And we'll be sharing the findings, the rich information that they give us publicly, beginning, we hope, as early as June this year, so that all of us can learn what is true across all of the disease states, what is true across all of Canada's current demographics, and how can we collaborate to better maybe meet those needs. Next slide, please. We welcome anyone to join the network, and it's very easy to do so. You can visit Health Partners' website at either of the addresses above. Participation is equally available in French as in English. And then just complete a very brief intake form to tell us a bit about you. And then you are in the network and will be administered surveys that are all optional for participants to choose whether to respond to or not. We are guided in this work by a steering committee. Next slide, please. That is made up of people with lived and living experience themselves that come from across Canada and that have, as you'll see here, experience living with a variety of health conditions. And I am deeply grateful to all of them for their support and guidance in how we conduct ourselves with regards to the Health Advisory Network. Their role, as you'll see on the next slide, is to advise Health Partners on how we work with the Health Advisory Network, so that we really make sure that, although many of us at Health Partners are also people with lived experience of chronic illnesses, we want to make sure that we are doing this with those with lived experience as opposed to those with lived experience. Steering committee helps make sure that that's the case. They also play a part in helping us reach into communities across Canada so that the network, as it grows, is representative of Canada's current demographics, and that we have folks from coast to coast to coast who are responding to the surveys and sharing with us their wisdom. Our steering committee also recommends survey topics, approves surveys to make sure that we're asking the right questions in the right ways, and they will be reviewing and approving our reports of findings from those surveys before publication, so that we make sure that we're characterizing what we learn from this network respectfully and fully. And then they also continue to ensure that we have a robust steering committee that is in itself diverse and representative of the Canadian population. So enormous gratitude to our current steering committee. If anybody listening is interested in joining, please let me know. We do have a few seats still available. I'm really pleased to say that only a few weeks into launching this network, we already have nearly 200 members in the network. And you'll see here they're coming from across the country. Most provinces and territories are represented, although we recognize we need to reach further into some of these provinces and territories to make sure that we're, more like the Canadian population in our distribution. We're really pleased to have some people in the network who are newer to Canada, and that's wonderful, and we would like to have even more. And we also have representation from most of the cultural and ethnic backgrounds that we track, although we are presently still over-indexed towards white people, and we are hoping to round this out in due course. So we're off to a good start, still more to do on the recruitment front. Once we learn from our network in response to the surveys that we'll be administering, we're going to share the findings publicly via our website, via social media, and we're going to especially share them at the Patient Engagement Forum, which is a conference that we will be co-hosting in November of 2025. Details are still being firmed up. I invite you to follow the forum at the website you see here on the slide. And it's really a great occasion for representatives of all parts of the health ecosystem, government, industry, patient groups, patients themselves, to come together to talk about best practices globally in terms of patient engagement, and also how we can improve those practices in Canada. Last year, we were really pleased at the inaugural Patient Engagement Forum to have representation from many, many different organizations. We sold out at 105 attendees, and this year we have capacity to welcome many more. So we look forward to hopefully seeing you there. Back to the Health Advisory Network. Our plan forward is in April, just a couple weeks, we'll be launching our first survey to the network, which will be on workplaces. What was your experience in your workplace when you were diagnosed with or living with a health condition? How did the supports provided by your workplace meet your needs or not? And what can we learn from that? We plan to follow that with a survey on, I'm sorry, it says charities, that's a mistake, on diagnosis. So what was your experience of learning that you had a chronic condition? How did you get your needs for information about living with that condition and for support on how to live with that condition? How did you get those needs met? And did that meet your needs? We'll be gathering those insights. We'll be learning, probably going back to the network to dig deeper on the findings, and then publishing them in a little bit later this year, as I said, to anybody, so that we can all learn from the wisdom of the members of the network. And then we'll keep asking more and more questions through more and more surveys as we move forward. With all that said, that was a lot from me. Now I'd like to open the discussion up and welcome my friends and esteemed guest speakers, Brock Carlton, Lynn Simoneau, Alison Cowan, and Shauna Almas, to the discussion. Welcome, everybody. Thank you so much for joining us today. I'd like to start by asking a question of each of you. And so I'll pose this question and invite each of you to give me a brief answer. And while you're doing so, please introduce yourself and your organization. So please let me know, what is your lens on the need for a broad network of people with lived experience of a variety of health conditions in Canada? Brock, let me start with you.
Sure, thank you. Thanks for inviting me to participate in this panel. I really appreciate it. I'm Brock Carlton. I retired in 2020 from the job as CEO of the Federation of Canadian Municipalities. I retired into COVID. I retired into a diagnosis of Parkinson's. So, when I think about the network in your question, Kim, I have 2 points that I think are important. One is about the system. The other is about learning amongst the individuals who have different health conditions. So kind of the traditional approach has been that the perceived needs are seen through a lens of the system and of the scientists. And while they do great work, they don't always get it right. And those of us with a disease know what we need, but don't necessarily know what the strategies or the practical application of science would be to get to address what we need. So the vision of this network is to help kind of ground truth the science in the system, in the realities of those of us who live with Parkinson's. So there's kind of 2 sides to this. One is the system side, one is the us side, and the hand is a unique mechanism that can knit together these 2 different spheres of influence: the science and the system, and the people with the different health conditions. The second point I want to make is this network will help create connections and possible collaboration between the different people, the different health conditions and health challenges in ways that is new. Traditionally, those networks have been focused specifically on one disease. So I'm part of the Parkinson's Advisory Council that advises the CEO at Parkinson's Canada, is exclusively about Parkinson's, and is very much needed. It's a very traditional approach, whereas the HAN actually brings forward the opportunity for cross-fertilization and integration and connection collaboration amongst those people who have different health conditions, but come to similar needs or similar approaches to dealing with their diseases. So I think that for me is this unique, groundbreaking nature of integrating people with lived experience with the system and really informing the system, informing the world through the lens of the people who have these existing conditions.
Fantastic. Thank you so much, Brock. Lynn, can I invite your perspective?
Sure, thank you, Kim. I'll be speaking a little bit better later about my role at Dexcom and what I do from the stakeholder engagement perspective. But what I want to say right now is first, healthcare has always been important to me. I'm a trained pharmacist. I'm a caregiver for my mom who's living with type 1 diabetes. I am embracing the idea of contributing to a broader unified voice through the Health Advisory Network. What I'm hoping to achieve and what I think this network will provide is opportunities to share best practices across different disease states, sense of belonging with a broader community, have our voice heard, and really make a difference to inform and improve workplace and health system strategies over time. I think I've experienced over time in different work forces or companies, industries, that there's often lack of awareness and a need for education of the realities of people living with different disease states. And I'm hoping that as part of the participation and the deliverables and what we can achieve as part of this network, we can inform those strategies moving forward.
Fantastic, Lynn. I share that goal. Thank you. Allison, I'd love to hear your thoughts.
Thank you, Kim. Hi, everyone. Thanks for having me today. I'm Allison Cowan, and I'm Director of Strategic Operations and Partnerships at the Mental Health Commission of Canada. And I'll start by saying one of the founding principles of the Mental Health Commission was to amplify the voices of people with lived and living experience. So it's something we live and breathe. At the MHCC, kind of working closely with people with lived and living experiences is truly foundational to the work we do to tackle Canada's mental health challenges. But, I also bring a lens of experience in seeing the value of these health advisory groups in our work, but also a lens of personal experience and experience as a caregiver across a number of different family members. I'll speak a bit about some of the benefits we see in our advisory groups at the Mental Health Commission to kind of set the stage a bit. We see a number of benefits. Diverse perspectives is one of them, kind of that firsthand experience, which offers insights into real life challenges and needs with a given situation. Also authenticity. So people with lived and living experience offer those authentic insights from experiences with any health challenge. So this truly kind of fosters trust and credibility, enhances the knowledge exchange within communities. It's also, we see a lot of empowerment. So engaging people with lived and living experience empowers them by providing a space to share stories and perspectives, which of course, in turn, helps to reduce stigma too. So sharing these personal experiences can help challenge prejudice and stereotypes and increase literacy around different health challenges. And I know, Brock, you spoke about this as well, but enhanced collaboration. So we see that advisory groups create an opportunity for that co-creation. And co-creating can lead to innovative solutions and create a more inclusive and informed decision-making process, both in work and we'll talk a little bit later too about in the workplace. Advocacy and awareness is another piece. So advocating for change can help raise awareness and positively influence public opinion. So when I look at all of these benefits in our experience, and I think of a broader network that covers a variety of health conditions, I think that's really powerful. We've been collaborating with Health Partners Charities recently, as the Mental Health Commission is one of the Health Partners Charities. We've been looking at the intersection of mental health and physical health through a series of interviews and articles, and we recently hosted a webinar in partnership with Health Partners and the Canadian Hemophilia Society on managing the mental health impacts of living with a chronic health condition. I've found it's so striking to see the connections that exist and the stories that have emerged about challenges across the board, accessing care, inequities in the system, gaps in the system, you name it. So as I look at all of these benefits, building a bigger table and increasing the scale of this engagement is a tremendous step. I'm really looking forward to seeing the hand come together.
Thank you so much, Allison. So well said. Shauna, let's hear from you.
Hey everyone, Shauna Elmas. I'm the Executive Director of Development at Health Partners. Thank you so much for having me here today. Health Partners we're a pretty uniquely positioned organization in our health ecosystem. We're well connected with industry, a variety of employers and employees, patient organizations, patients and caregivers themselves, other not-for-profits, government, regulatory bodies, academia. And what I hear across the board is that as the connectivity between health conditions and systems, therapies, care providers, as we move towards more holistic care, for example, as diabetes drugs become cardiovascular drugs, become weight loss drugs, I'm hearing more and more, and we've heard from several of the panelists today, an increasing need for the voice of the patient with comorbidities or multimorbidities, or more generically, the voice of the patient and their caregivers. And the barriers that I'm hearing to finding and leveraging this voice of the everyday patient is twofold. One, logistics. Where do you find these voices? Finding the voices of patients and caregivers with a single morbidity is fairly manageable. But given that Canada is one of the only countries in the OECD that doesn't have a disease agnostic patient organization, where do you go to find this representative voice? And often Health Partners gets that call. The other one is cost. Because it's more challenging, oftentimes it is more costly to find that representative patient voice or representative cohort. And patient engagement is often one of the first line items in a budget to be cut, or so it seems. And then on top of that, part of engaging patients and caregivers in a meaningful way is to value the time that they give and the efforts that they put in, most tangibly in remunerating them for their time. But that said, encouragingly, even though patient engagement has been a crescendoing buzzword over the past decade, what we hear from patients and caregivers is that they still want to be heard, really heard in a meaningful way that impacts real change. They haven't given up, and they're still really eager for and searching for platforms to offer a voice that has real impact. So that's kind of some of the things that I hear across the board, across the many different stakeholders that we work with.
Fantastic. Thank you. So, Brock, I'm going to turn to you now. As someone who lives with Parkinson's disease and as a really valued member of the steering committee that guides Health Partners in its work with the Health Advisory Network, tell me a bit more about what value you hope the Health Advisory Network will bring. You're on mute, Brock, if you can.
Sorry.
That's okay.
I repeat some of what I said earlier about the value. I really think that the HAN is an opportunity to draw on the vision of different, draw new vision and interact with different disease states, so that people can communicate across the different diseases and learn from each other. And that's one of the values I think the HAN brings. It's also, for me, that this is not repeating what I said earlier, this for me is a very personal thing, in that when I was diagnosed with Parkinson's, I made a commitment to myself that I would be physically fit and I would continue to have a purposeful life, make a contribution. So when I think of that, I think of kind of three spheres of possibility for me to engage. One is at an individual level. Some of that is about my own care, and some of that is helping people who are newly diagnosed with Parkinson's come to understand the landscape that they're living into. The second sphere of influence or purpose for me is at a community level. And so I work pretty hard at knitting together the Parkinson's community in Ottawa, fundraising, that sort of thing. The third sphere for me is the national level, and this is where the hand comes in, because it creates an opportunity for me to engage in the national level and help shaping new initiatives like the hand. And so that gives me a sense of purpose and a sense of contribution. And that's one of the ways of managing the Parkinson's disease that I live with. So this triangle of personal involvement is a really important part of my disease management. I really appreciate the opportunity of being in this. I think that the hand, as I said earlier, is a great opportunity to knit together different experiences and towards a more common approach and an improved health system to respond to the needs of those of us who have these diseases.
I can relate to that, Brock. When I was diagnosed myself almost 30 years ago with type 1 diabetes, I also felt that need to be able to give back to the community. That's kind of partly how I ended up here where I am today. So I honor that in you. Thank you for that. I'm going to turn now to Allison, if I can. So I apologize. I'm turning to Lynn. Lynn, in your work in market access at Dexcom Canada, you engage people with lived experience daily. What challenges do you experience in doing so, and how do you hope that the hand might help with that, if at all?
Well, thank you. And yes, I can speak about my current role at Dexcom Canada, but over my career in the pharmaceutical industry, I've worked in several disease states. And the principle of market access is always the same. So what market access is we bring to market innovative pharmaceuticals or medical device. Today at Dexcom Canada, we do continuous glucose monitoring systems for people living with diabetes. So my objective is to showcase or demonstrate the value proposition to government payers and private insurers across Canada. So there's the clinical angle, right? What's the incremental value of this new innovative therapy? There's the economic component. Is it cost effective? Is it good use of money? And can they afford it? But there's also an important perspective, and more government payers and private insurers are listening to the voice of the patient perspective, to really make it relatable. If I'm going to make this decision, it's one thing to look at the science, at the data, at the numbers, but what does it mean to people? Mm-hmm. And that is a critical component to our value proposition. So as part of my work, yes, I do engage with several individuals living with diabetes, type 1 or type 2, and that's the component they bring to the conversation, make it very relatable. And there's nothing that convinces more a minister or prime minister or government official than, for example, a child, walking up to him with all the courage, standing tall, 6 years old, and saying out loud why this is important to them. It's just an example of really people like that individual will remember that 6-year-old having the courage to speak up. Same applies for Brock in different, in a different therapy, etc. Also important for individuals to speak up in terms of health benefits as part of their workplace. Our technology in the beginning was not known significantly, and there was a handful of patients wanting and seeing the benefit of this technology in their daily lives, really being a game changer and a lifesaver in many instances. And as an individual who benefits from a workplace environment, anyone can go to the lead of benefits or HR or management to speak up. And oftentimes it's the employer, which we call in our world the plan sponsor, that really pays for the health benefit, that has the decision-making power. So having people know about that and making a difference, not just for their own benefit, but for the benefit of others living with similar conditions in their workplace, I've seen so many examples of people really feeling empowered by that and really paying it back and empowering others to do the same through their experience.
Thank you, Lynn. So it's really about adding with the experience of the patient or the person with lived experience. It's making those reports of the benefits from a kind of quantifiable perspective of a therapy. It's bringing them to life, isn't it? It's making them three-dimensional.
Absolutely. Yes.
Alison, you spoke a little bit about the tremendous work that the Mental Health Commission of Canada does engaging people with lived experience of mental health related conditions. How does the Health Advisory Network support that work and add to the value that MHCC derives from its membership as a Health Partners charity?
Thanks, Kim. I'll start by saying I believe, and I think I'm in good company here, especially with some of what Lynn's just covered, that health services should truly be centered on the people that use them and truly support those individual journeys to recovery with the right choices available as well. I'll start a little bit by talking about the work of the Commission and our context. So as I mentioned earlier, the Mental Health Commission is founded on that principle of amplifying the voices of people with lived and living experience. So we have been doing this a long time, but have formally formed 2 advisory groups. So one is our Youth Council, and this is individuals aged 18 to 29 with diverse lived and living experience from across Canada. They bring that youth perspective on mental health and recovery. And our hallway group, which I affectionately call the grown-ups, 30 plus, also with diverse experience, also typically have knowledge and experience in leadership in grassroots or community levels. So we really rely on these groups to help us inform not only the strategic direction and operational activities of our organization, but around programs and projects and policies that we support and advise on and develop. So I absolutely love working with these groups. It's an incredible experience. I feel so fortunate to have access to this knowledge base because the expertise and the passion for the work we do is amazing to hear. We're partners. We share that same goal on creating a better mental health system for all Canadians. And embracing this knowledge and expertise really does help our work better reflect the needs and the preferences of those who matter most and when they're working through health conditions. So what does this look like in action for us on our project work? Engagement happens at many points. So think about kind of from conception of a specific program we might be working on straight through to knowledge dissemination and follow up. So whether we're looking at the impact of cannabis on mental health in racialized communities, or hosting a workshop on housing first approaches, looking at mental health in the justice system, or right now we're doing work on developing standards of care for severe and persistent mental illness. These groups play such an important role in how the work is done, helping us to determine where are the important areas for us to focus on. It also means external engagement when acting as ambassadors. So one example that I love recently, because often this involves speaking opportunities and sharing experiences outside our organization as well to improve mental health literacy. We recently had a youth council member participate in a panel on gambling in youth last fall and providing testimony to the Senate of Canada. So, some of the impact is widespread. So going on to the second part of your question now, Kim, as a Health Partners charity, I'm excited to see the Health Advisory Network amplify and increase this kind of work and the scale of involvement in people with lived and living experience, advancing physical and mental health of all people living in Canada. So being a part of this health collective that you talked about earlier in your presentation, Kim, it's been a great experience for us. This new Health Advisory Network is just one more example of the power of health organizations coming together as a collective. And there's, as I mentioned earlier as well, there's such strong connections across mental and physical health conditions with so many common experiences that we've seen come up again and again in that recent work we've done. And I do think that the HAN will further help to inform understanding across the health partners charities of how our needs really so often align. I also see a great opportunity for the network to help inform our program and policy work on a larger scale. Perhaps also surfacing opportunities for collaboration across the health partner health collective. Also think there's opportunities for broader community to participate in the advisory network, and I know as well, each time we are looking for participants in our advisory councils, the interest is incredibly high. So I'll close by saying creating more opportunity for participation in this kind for people with lived and living experience is really absolutely invaluable and will be well received.
Fantastic, Allison. Thank you so much. Shauna, you mentioned in your introductory remarks how you kind of work at the intersection of many different sectors, businesses, government, health charities. What are you hearing in your day-to-day on the need, and how does what you've heard from the others line up with that? Why should an employer consider getting involved with the Health Advisory Network or with Health Partners?
Yeah, thanks, Kim. What we hear is very similar to actually what you just heard from Lynn and Allison. Many of us, from industry to charities to patient organizations, who share similar corporate objectives, missions, and visions towards, we're all working towards a healthier Canada. But it could be exponentially strengthened by anchoring on and leveraging and incorporating the voice of patients and their caregivers. But like I said earlier, we also all face that common challenges, barriers of budget and logistics, especially when it comes to patients and caregivers caring for patients with comorbidities, multimorbidities, or that representative voice of the everyday patient. And this is what the HAN could really help us overcome. We also hear employers across the board looking to do three things. One of them is enhancing employee well-being and fostering a more inclusive workplace culture, which means they could benefit from insights to inform how best to support their own employees, 60% of whom we know are living with at least one chronic condition, many of which are invisible, or caring for someone who does. They're also looking for actionable insights, access to information on the challenges that their employees can and do face as patients or caregivers themselves, to enable them to implement solutions that improve productivity and reduce absenteeism, really helping support their own employees, many of which they don't even know are actually working through something like this. And third of all is strengthening their corporate reputation, credibility, trust, brand, positioning the organization as a leader in corporate social responsibility across our ecosystem. By supporting these efforts and perhaps even participating themselves, they're elevating and incorporating the voice of patients and caregivers in all that they do, and that can go a really long way towards building brand, reputation, etc. And so part of your question was, why should an employer get involved? And it's because they can play a really significant role in supporting this work, and it's actually a critical component to bringing this to life. And it won't cost a thing. It requires little to no effort, and it has the potential to benefit both internal HR and cultural variables, but also externally, like I said, with corporate social responsibility and public relations. And, as we've had these discussions with employers, our team keeps hearing, this is a no-brainer. Why didn't we know about Health Partners before now? Absolutely, we're going to get involved. Absolutely, we want to support. And so some of the examples of how employers can get involved include signing up for the HAN themselves as individuals, if inappropriate, supporting our recruitment efforts, helping us build this network of a representative voice of patients, sharing it with employees, perhaps more broadly across personal and professional networks. The more that we get the word out, the bigger we will grow. And then third and finally is hosting a free employee giving campaign. It doesn't cost an organization anything. It ultimately provides the financial support for the HAN, but also the myriad of ways that our members of our health collective have for a very long time and continue to engage and support patients and caregivers in a number of different ways. So there's a number of different ways none of which cost anything, very little effort required, but have really dramatic impact on the success of the HAN when it comes to employers getting involved.
Those are some excellent tips, Shauna. Thank you. And we'll have a slide in a few moments that puts those all on one place and makes it easy for you to learn more. I've got one more question for our panelists that I'll pose in just a minute, but I welcome those of you listening in to add your questions in the chat or the Q&A feature of our webinar. Happy to field some of your questions. So my last question is really for anyone, and I'll invite you guys to jump in whatever order suits you. What kind of insights can the Health Advisory Network provide to help inform employer strategy and support for people with lived experience in the workplace? Shauna mentioned 60% of employees are already living with a chronic condition or supporting someone who does. So people with lived experience are literally all around us. They are us. How can this help employers better support those people with lived experience among us?
I can jump in, Kim. I think one of the great benefits of the HAN is the broadly dissectable nature of the data. Because of the holistically representative sample we're looking to pull from, we can generate insights at multiple levels of specificity, from broad to increasingly focused on the same topic from the same data set. And this can help highlight key issues and grow awareness in support of internal support, advocacy efforts, which many of our stakeholder groups engage pretty heavily in. And we can help with nationally representative data all the way down to local geographies, from disease agnostic to comorbidities to multimorbidities, broadly representative of different sociodemographics to very specific subsets and more. So this broadly dissectable data and being able to look at it at different levels depending on what the needs are or the insights that we're looking to generate could be really powerful. And then, of course, at the end of the day, all of this is to impact meaningful change towards a healthier Canada, which is what all of us are really looking to do. So could be pretty impactful.
Excellent point.
I can go next. I want to come back to Shauna, what you mentioned in your previous question, right? How we can elevate awareness about the HAN and health partners overall. I'm happy to say that within my own workplace, I have actually triggered a employee giving campaign last year towards year end. The results of that campaigns were shared with our general manager in an all employee town hall meeting recently. And there is an intention to see moving forward in 2025 and beyond how we can expand and build from that giving campaign and how we can do better to support the community. We're a company and a workplace that is fully dedicated to diabetes. It's our DNA. So all we do is around diabetes. We 24/7, right? So, and it's refreshing to see how else can we also contribute beyond the diabetes space. And I love the fact that Health Partners is a network of several conditions. And you know, life happens, and you never know as an employee, as an individual, what will strike you next. And sometimes there are surprises in life, and it's good to have a network of resources to tap into. That's what I see as you know, the value of the HAN. And over time, through initiatives like that and partnering with Health Partners overall, we can help decision makers within different workplaces to you know, understand the realities of either being a caregiver or living with a certain condition, develop empathy, support. Overall, I think that's what we can most likely you know, aim to what's the word en français? Move forward the strategies of workplace and well-being. Sorry.
Absolutely not. That's wonderful, Lynn. And thank you and Dexcom Canada for your support for the Health Partners member charities. We are so grateful. Allison, would you like to chime in on this last question?
Sure, and excellent points made, Lynn. And we do a Health Partners workplace campaign as well, and I've had a great experience. But to answer your question, Kim, about kind of how HAN can provide insights around employer strategy and improve the workplace, I almost think that 60% number is understated in terms of the impact in the workplace. When I consider the incidence of mental and physical health issues in the population, I think our workplaces are full of people with lived and living experience, whether their own or as families or caregivers. And I think often employers have the tools to support effectively already in their toolbox to improve employee experience. It just helps to know which tools are most effective and which ones to pick up at the right times. I also think the principles of accessibility also apply that, if you make improvements in the workplace that help to support people with lived and living experience, you're also helping everybody. When I think some of the ways that we've seen that health advisory groups help support people with lived and living experience in our workplace, it's really around that providing strategic direction and vision, guiding some of our actions and our responses, helping to better understand and articulate some of the thornier culture shifts that might be required. Communication's a big one as well. Helping to communicate the value of what's needed and the whys behind the changes. Encouraging and supporting that collaborative engagement. And, even at the tactical level, helping to support strong actions that make good business sense in the organization and are appreciated. Recently we've had experience engaging our advisory council members in procurement, helping us to choose consultants and make some strong ethical and balanced choices there. And everyone really appreciates that. So I also, though, I would say have personal observations on the benefits that I've seen. And I find our work with the advisory council really does improve that line of sight between the work that we do and the people that benefit from it, which in turn really drives more purpose in the workplace. And we know that purpose is so important to health. And all of this just keeps us on the right track and focused where it matters.
We're all
could go on, but
I can really relate to what you're saying. We're all here at the end of the day doing the jobs that we do because we want to support people with lived experience, and how better to know that you're on the right path than to ask them. I just wanted to comment too on a point you made earlier, Allison, about how I think that the needs of different communities may often be more similar than we might think. Recently, you held a webinar on the mental health impacts of living with chronic disease, and I tuned in. It was a fabulous discussion. And I was really struck by how the experts that you had on, the needs that they were describing, although they lived with very different conditions than those I've experienced personally, their needs were really similar to ones I've heard in my community or experienced myself. And so I'm really excited to see what the first survey that we administer to the HAN tells us about what is common across morbidities and disease states. And I think we might be able to find some really powerful ways to make differences from doing that. Brock, I want to let you add anything here.
Sure. So when I heard your question, I wrote down the word stigma.
Stigma.
Well,
yeah.
Inevitably, people with health challenges would require accommodations in the workplace in terms of perhaps different work schedule flexibility, that kind of thing. And I think the work that we're doing in the HAN can help inform the employers that this is not a weakness. This does not mean there's a diminished skill set here. It's just is. And we can help inform the employer about how they can work to reduce the stigma, enable people to work and contribute in a way that works for them as well as for the company. We had at FCM, we ran enormous campaigns in the workplace. It got to the point where we had to kind of dial it back because it was taking so much time, but it was part of the corporate culture. So you can, I think Health Partners can help build a corporate culture of empathy, caring, rather than stigma and diminishing the people who are suffering from these health conditions.
Love that goal. That's the goal. I'll ask my colleague to bring our last slide up, but while we do that, I've had another question around what other services or supports the Health Advisory Network will put in place to ensure continued engagement from those with lived experience. Today's webinar has been aimed at organizations that are working in the patient engagement space or at companies that are considering getting involved somehow. But we're also really going to be focusing on engaging and supporting those within the Health Advisory Network. We're planning a webinar for those members on April 4th to get to know one another, and so that we can hear from the members of the network what they'd like us to be asking them about, talking to them about. And so it's really going to be an active network that's a two-way conversation between Health Partners, the steering committee, and the network itself. So if you are interested in joining the network or already have, stay tuned for that. I guess we'll go to the very last slide. That's a bit of a summary of how people that are listening today can get involved. And that QR code there will bring you right to the webpage of the Health Advisory Network. And so kind of as Shauna was referencing before, there's lots of ways that you can help make this effort a success. Please invite those in your personal or professional network, your employees, if that applies, to join the Health Advisory Network. I don't really know anybody who doesn't have experience of a serious health condition, either personally or as a loved one. And so really everyone's perspective is welcome. Please feel free to suggest topics that you'd like us to survey the network on by emailing us at network@healthpartners.ca. Consider supporting Health Partners in doing this work by hosting a workplace giving campaign. Shauna highlighted some of the amazing benefits that those who host campaigns for Health Partners have commented on: better employee engagement, better corporate reputation, feeling good, which never hurts. So to learn more, email us at info@healthpartners.ca. Please follow Health Partners on social media or sign up for our newsletter via the hyperlink there to receive reports of findings from the Health Advisory Network, hopefully as early as June. And also you're welcome to consider attending and even sponsoring, if that fits your priorities, the Patient Engagement Forum in November in Toronto. Please feel free to reach out at any time to me or my colleagues at Health Partners through our website, through social media. This recording will be placed on Health Partners' YouTube channel, so you can rewatch it if you're curious. And I'll just close with one final message that really guides us at Health Partners. We are proud to be a collective because we believe that alone we go faster, but together we go further. And we're honored to go further with our 20 member health charities and with the valued input of all of those in our Health Advisory Network and you today. So I'll close by thanking again Allison, Lynn, Brock, and Shauna for your thoughtful remarks today. Thanks to all of our listeners for tuning in, and I wish you all great health and a fantastic rest of your day.